In this video, we're going to talk about deep vein thrombosis. A DVT is a development of a thrombus or blood clot within a vein. Oftentimes, these DVTs occur in patients who are immobile because they have lack of muscle activation, they're not getting up and moving. These can be like spinal cord injury patients, stroke patients, patients who have had surgery in general and are just not moving as much. This condition can be life-threatening because the thrombi or blood clot can break off and float freely within the venous system. And if it travels to the lungs, it can be deadly. So some signs and symptoms that you want to look out for in your patient are swelling, inflammation, redness, and pain in the calf. And the patient may also complain of tenderness and pain and tightness in the calf. So if your patient experiences these signs, you want to report them immediately to the nursing staff and to the doctor. Some things that you might want to do to prevent a DVT would be early range of motion. So in the acute phase of rehab, it's especially important to, if your patient is able to get up and moving, get them up and moving, or if they're not, then do some passive range of motion to get some muscle activation going. Also, it's important to educate your patients on the importance of wearing compression stockings, even if they don't want to educate them why it's important, and to educate them about DVTs and the signs and symptoms in case they start experiencing them, and tell them that it can be life-threatening, so they need to get help immediately. When a thrombus breaks free and enters the venous bloodstream, it's called an emboli. When it blocks a pulmonary vessel, it turns into a pulmonary embolism, and this can be deadly. 10 to 15% of patients who have a pulmonary embolism do not live. Some signs and symptoms that you can look out for in your patient are chest pain, rapid breathing, tachycardia or increased heart rate, anxiety, restlessness, apprehension, and a persistent cough. If your patient is experiencing any of these symptoms, you should report it immediately and call 911 because it is very life-threatening. Some treatments for pulmonary embolism are supplemental oxygen, intubation if it's severe enough, blood thinners, and surgery in very severe cases. So to prevent a pulmonary embolism, you have to take measures to prevent a DVT, so wearing those compression stockings, early mobilization, and just be on the lookout and educate your patients continuously.